Hi everyone, my name is Batool, and today I'll be sharing my undergraduate summer research project titled Changes in Pediatric Emergency Department Utilization Rates During the COVID-19 Pandemic. Imagine you're a 14-year-old teenager on the cusp of what you think are going to be the best years of your life. Now, imagine it's March 15th, 2020, and the whole world just shut down. Instead of seeing friends, going on adventures, and trying out new things, you're forced to stay at home, distance yourself from your friends, and transition into online schooling. For months, you bear witness to the stress of day-to-day living during the global pandemic. How do you feel? How have your feelings changed compared to before the pandemic? How did the pandemic impact your mental health? The COVID-19 pandemic was characterized by unprecedented disruptions in our daily lives that exacerbated feelings of anxiety, grief, and isolation, especially in children and adolescents. This contextual backdrop suggests that youth were particularly susceptible to mental health deterioration during the pandemic. That being said, there is no clear picture of how the COVID-19 pandemic has impacted indicators of severe mental distress, such as self-harm, suicidal ideation, and attempted suicide, in children across the globe. To expand our understanding of the subject, we conducted a large-scale systematic review and meta-analysis estimating the change in pediatric emergency department (ED) visits following episodes of severe mental distress from before to during the pandemic. We also investigated whether changes in ED presentations differed for boys versus girls, children versus adolescents, and across continents. We worked collaboratively with a science librarian to search 3 electronic databases for empirical, English, and peer-reviewed studies published between January 1, 2020 and May 17, 2022 that reported on changes in ED presentations for children or adolescents younger than 18 years of age before and during the COVID-19 pandemic. As part of my summer studentship, I helped screen over 6,000 abstracts and reviewed the full text of over 350 studies. Moreover, I helped to extract the data from studies that met our full inclusion criteria. We expressed the differences in self-harm, suicidal ideation, and attempted suicide-related ED presentations before to during the pandemic as ratios of the rates, and analyzed the data using random effects meta-analysis. 31 studies spanning 105 data points and encompassing 5.5 million youth worldwide across 16 countries were included for analysis. Results showed that in spite of significant reductions in pediatric ED utilization rates during the COVID-19 pandemic overall, there was strong evidence that ED visits following attempted suicide increased during the pandemic. Moreover, there was moderate support for an increase in ED visits following suicidal ideation and self-harm events. Our change estimates suggest that the mean increase in the absolute number of ED visits related to attempted suicide, suicidal ideation, and self-harm before the pandemic compared to during the pandemic was 28%, 18%, and 9% respectively. Moderation analyses suggested that there was good evidence that ED utilization for suicidality, a congregate measure of suicidal ideation and self-harm, increased in females more so than in males. Limitations in data availability prevented estimations of age and ethnicity-based moderating effects. ED presentations for severe mental distress indicators have increased considerably during the pandemic compared to pre-pandemic periods. However, our findings suggest that the mental health of children varies globally due to participant level, contextual, and methodological moderators. Indeed, this highlights the need to better explore variables that impact the likelihood of emergency department presentations in order to identify vulnerable populations and fine-tune intervention programs to best meet their diverse needs. Other limitations of our study include a lack of standardization between health records that leads to measurement error, a non-representative use sample, and a disproportionate focus on participants from countries such as North America, Europe, or Australia. In spite of the mentioned limitations, our study is significant for a plethora of reasons. First, this study serves to inform and expand future pandemic preparedness strategies by highlighting the importance of accessible mental health support. Secondly, it allows us to draw on various findings from high-quality studies around the globe to better understand how exactly the pandemic impacted ED utilization rates for people from different social, economic, and political contexts. Finally, this study serves as an anchor point to ground future research ventures in child and adolescent mental health in a time when mental health supports and resources are needed more than ever. Thanks for watching and for all those who made this research possible.